Have you heard of Iliopsoas injuries? Has your dog had an Iliopsoas injury? Are you afraid your dog is going to have an Iliopsoas injury? I'm Dr. Laurie McCauley from Optimum Pet Vitality, and we're going to talk about preventing Iliopsoas injuries as well as helping your dog heal from one if they've had one. And we're going to use Ollie as our demo dog. So we're going to talk about raising him up to strengthen the Iliopsoas. So first, who's Ollie? Ollie is a 12-and-a-half-year-old boxer Mastiff mix, giant breed dog who's had a femur surgery. He's had luxating patella surgery. He has wrist issues, a little bit of hip issues. And we're going to show you some great exercises that we can have him do for us. Now, we're going to talk about the Iliopsoas. The Iliopsoas, you may have seen this picture floating around on the internet, which is really pretty, except it's human. It's not dog. So it looks pretty, and we can talk about it a little bit, but realize this is like the best picture I could find. And this is from Chris Pasquini. Love his anatomy book. And we're going to show you on both pictures so you have a great understanding of it. So we would love to say in this picture that this is the Iliopsoas, because in this picture, this is the Iliopsoas. But this is a psoas minor. The psoas major, you can see it more here. It comes back. That and the iliacus, which comes from the wing of the ilium, and they both come to the lesser trochanter, together make the Iliopsoas. In the human, we have the psoas major and the iliacus, which is a really broad muscle coming down to the lesser trochanter. In the dog, it comes from way up here. It comes down, it goes through the abdominal wall to the leg, to the lesser trochanter of the femur. Where did the Iliopsoas muscle get injured? Well, most muscles get injured right where the muscle and the tendon meet at the muscle-tendon interface. So in the human, it's right here. In the dog, it's kind of where we see it, is between the lesser trochanter coming up in here. We can get tight muscles, we can get trigger points up higher, but that's usually the area we see a tear, right? Which is a strain. And I have seen so many people, when they rehab a dog with a psoas injury, do things like put him in the underwater treadmill, which can be okay as part of a Iliopsoas rehab program. But what you need to know is, when is the Iliopsoas going to get injured? When it's in long. Look at this dog jump, right? Amaze is amazing. And she has her legs kicked way out. The psoas has extension of the spine and full hip extension. That is like a super stretch for the Iliopsoas. That's when they're going to get injured. So if we take the muscle and we strengthen it when it's in short, right, with hip flexion and lumbar spine flexion, and then we put them into extension, we get a re-injury. So we can strengthen with the underwater treadmill, but we need to strengthen it in long. If we only strengthen it in short, then when they put it in long, they're going to get re-injured. But if we strengthen it in long, way less chance of re-injuring that Iliopsoas. So let's see how we can do that. The first thing we're going to do is think about putting the dog on a raised surface so that we can start to shift their weight back and start to stretch, get that hip into extension. So the Iliopsoas' job is lumbar flexion and hip flexion. So to get it in long, we want lumbar extension, a flat back, and hip extension. And if we've had an injury, we need to start low. So this could be a cinder block, a yoga block, a step. We can go up to the step. Real important, we said that we don't want the lumbar spine in flexion, so we need to make sure their weight is pushed back and their back is straight. What we don't want is them coming forward and keeping that lumbar spine curled in flexion so that they're not stretching their Iliopsoas. We want a nice flat back. Then, as they get stronger, we can actually take them to a higher surface. So in this case, we're looking at Ollie, and we have his front feet on a chair, right? It's a nice soft surface, but we need to make sure that the cookie is pushed back. So again, we have a straight back. We don't want them, whether they're coming forward or back, to have a curved lumbar spine. look at that muscle definition on that 12-year-old puppy dog, right? This is a great exercise. We can use it for all kinds of dogs. As we get higher, now we're on the back of the chair. We want to look at our knees and make sure we're not straight up and down, right? We don't want any pressure on our knees. We have a little bit of flexion in here. We have a nice hip extension. As we come up, we're strengthening the abdominal muscles, the paraspinal or apaxial muscles, and the iliopsoas, which is a apaxial muscle. So on the underside of the transverse processes and the vertebral bodies. It's a great exercise. The other thing I want you to see here is that the feet should not be higher than the shoulders. We don't want them way up here, right? We want the feet to be as high as we can in a safe position. This can be used for everything from puppies to adults to geriatrics to our athletes. And you say, how can that be, Laurie? Well, it can be because with puppies, it's an isometric exercise. We're not lengthening or shortening the muscles. We're holding them in a one length, isometric, same length place. And you can say, well, that's not very hard. Well, have you ever done a plank? Right? We're here and you're like, okay, this is great. This is easy. 1 minute, 2 minutes, 3 minutes. You get up to 4 or 5 minutes, and that is a heck of an exercise. It is great. And we can use it for our geriatric dogs at different heights, right? Our adults and our athletes we can strengthen. And if you say, well, for my dog, that's really easy. Okay, we can challenge them. The next thing to add would be an unstable surface. Now I want you to know, when we add an unstable surface, we are keeping the height the same because now it's actually a lower height because we've raised the back legs. And when that gets easy, we can go to an even more unstable surface. And then, of course, at that point, when that's easy, we can add our height back in. Now, remember, if you're recovering, if your dog, not you, is recovering from an iliopsoas injury, we start low and go slow, but we want to take them up before we take them to a position where we're saying, go, run as fast as you can, jump, whee! We're going to be putting that into full stretch. All right. I hope you had fun. I hope you learned something. I'm Dr. Laurie McCauley with Optimum Pet Vitality. I'll see you next time.